reflect on their visions of the future. We have some very recognizable and honored guests with us. Caroline Casey, the president of the IAPB itself, joins us. Professor Dr. Sandeep Ruit from the Tilganga Institute joins us. Very good to see you, sir. And, of course, His Excellency Ambassador Walton Webson, the permanent representative of the mission of Antigua and Barbuda to the United Nations, and of course the co-founder of the UN Friends of Vision Group, joins us as well. A round of applause for our three VIP guests, or as I call them lovingly, our X-Factor judges for today. But it isn't a competition. But I might say, actually, just as I begin to set the scene, I'm going to ask you momentarily, honoured guests, why this session matters so much to you. But let me just set the scene. The IAPB Systems or Young Systems Leader Awards is all about recognising and celebrating early career eye health professionals who dedicate an aptitude and a motivation to drive a systems mindset through their work. And we might come back to this. So that could be through their organisation or through their own personal development. So what has happened, and most of you know this, is we had nominations from around the world, and after that, 9 individuals were selected by the regional chairs to become our Leader Award winners in 2025, because they are all, in their own way, exceptional, and they are all driving progress. So we'll get to meet them one by one, but Caroline, let's start with you. Why this matters?
This is the session that I have been waiting for the most. Why does it matter? Because each of them are exceptional, but together they are unstoppable. Yeah. And it is the future of eye health and eye care that we have here. They live in a completely different world to what I was born in as a 53-year-old woman. And the energy and insight that they have. But can I just say, this is something that as the president of the IAPB, I really wanted to see. And last year, when it was launched in Mexico, it was the highlight. And then to see our 8 awardees here, but 9 is just phenomenal. Yeah. And it is our dream that we will have one from every country in the world. And I just wanted to say, they are exceptional at doing what they do, but they are exceptional people, and I could not be more proud of every one of you. You are incredible and amazing, and I just want, please, to recognise them.
Caroline, I agree with every word of that. Also to add, I'm also here because they'll each be receiving my CV over the next 10 or 20 years. So thank you in advance. I'm so serious. Dr. Ruit, what would you add?
I think it's really wonderful to encounter these upcoming awardees and who are really the future of the next decade. And it'll all depend on how their attitude, how they present, and what their ideas about ophthalmology. And we would like to see how they choreograph their next 10 years. And I really think they are the future of ophthalmology, and it'll be very interesting to see all 8 of them to come forward and listen to them. Maybe we'll have much more to learn from them than teach them. Thank you.
Yeah, hear, hear. And you have new allies from today onwards, that is for sure. Ambassador.
Thank you. Like both Caroline and Dr. Rao, I believe in the extraordinary talent that I hear these young people are bringing to the table. You know, we think it's money or technology will change and make the difference in the world. It's people. And it's people like these. They're not helping us to meet the future. They will shape the future. And I am delighted and honored to be a part of that journey.
Thank you, Ambassador. Hear, hear. So what we'll do is we've given, I mean, it's not fair really, but we've given each of our young systems leaders just 3 minutes to share some thoughts. Do you think it was 6, 5? 3 minutes to share some thoughts on the future of eye health and their vision, if you like, of the future. But what we'll do is ask them up, maybe three initially, and I'll introduce them as we go. But why don't we give a round of applause as they come to the stage. Amir Abu Adela, Pati Janyani, and Ketumetsi Tamani. Come up, one and all. Amir, welcome. And don't go too far, Amir, because I think you might be up first. Welcome, Pati. Welcome, Ketumetsi. Come and have a seat. Now, Amir, your 3 minutes starts as soon as you're ready at the podium. But even for walking to the podium, you'll get a huge round of applause. Amir's here, everybody. Welcome.
Namaste. Good afternoon, everyone. I'm Amir. I'm an optometrist and a global advocate and a passionate believer in a very important sentences that sight should not be a privilege, should be a right. Today, I'm here to tell you that the blindness is a policy choice. Can you believe every 5 seconds someone is going blind worldwide? And half of them didn't have to. So blindness and vision impairment are preventable, yet millions suffers because of the governments are not acting so fast. So let's look into the numbers. We have 1 billion people live with preventable vision impairment out of 2.2 billion, and 20 million children worldwide. They struggle in schools, not because they cannot learn, but because they cannot see. So now I want to ask you, why is something so basic still overlooked? Vision care is often missing from universal health coverage. And a lot of children in schools, they didn't get the screening as well. So why not vision correction, the cheapest, most life-changing intervention on the planet? In Lebanon, we didn't wait. The Vision Care Association, and which I'm proud to lead, we took a stand. In 2019, we worked to amend a new law to regulate optometry profession and to give more scope of practice. We worked with World Council of Optometry and Specs 2030 initiatives and GOPA to help us in doing policies. Also, we're collecting data through the screening, and that data will help to prove for the policymakers that we need action. And lately, we work on capacity building or capacity strengthening, training a professional and supporting new optometry leaders. So a world without preventable blindness is possible, but only if we fight for it. How we can fight for it? So the policy is powerful, but if the people work for it. Let me end with this. A world without preventable blindness is possible, but it won't happen with silence. It happens when we advocate, when we challenge, when we lead. So let's stop treating vision care as a luxury. Let's make it what it should be always, a right. Thank you.
Thank you, Amir. So what we might do is we might ask our panel to reflect on the three after you've heard them, if you like, and then we can introduce the next guest. But again, it's a privilege to introduce our next Young Systems leader. So as they take to the podium, please give it up for Pati Janyani.
I hope you can see me from the far, looking at my height. Yeah. So, one fine afternoon, as encouraged by one of our community health workers on the field, I visited a home of a woman. As I stepped in, there were two women working on their household chores. As you move forward and look, there was one woman who was facing a lot of difficulty while doing a household work, especially even walking. As I just move forward and look, she has a hypermature cataract. We, working in the field for so many years, still seeing women not accessing the eye care or not accepting the eye care. Why? Women are 12% more likely to experience vision loss than men, 8% more likely to be blind, and 15% more likely to suffer moderate or severe visual impairment. According to the British Journal of Ophthalmology in India, women are 35% more likely to be blind, 69% more likely to be cataract compared to men, yet 20% less likely to receive cataract surgery. Why? Looking at the barriers, why is the situation, and in response to this inequality, as an organization, we took a first step, and reaching the unreached, we established the primary eye care centers. These primary eye care centers has a purpose to reach and to give this proximity and convenience to women and marginalized groups to access the eye care on their choices and at their preferences. Today, after 5 years, we are seeing almost 0.1 million patients in our vision centers every year, and out of which 50% are women. That is the progress, but do you think 50% is enough? I agree that many organizations, institutions, and individuals are making significant efforts to increase the access for women and marginalized groups, but despite there are setbacks that still exist. Let me share something. I was a part of one of the national conference very recently where we have 50 leaders in that room and there was only 4 women. Change must come from the top, but also from the grassroots. We need to empower the women in our communities, support them to take the leadership, and most important is to include them in policy development. This is not about representation. It's about understanding the needs that are often invisible. It's about building systems that are inclusive by design, not by afterthought. It's time that we go back to our basics, learn, listen to the women in our communities, identify them, empower them from grassroots to as a leader, and walk alongside them. Thank you so much. And just a caution to everybody over here is, given that access alone is not enough, how we can actually intentionally develop a system which are inclusive to everybody. Thank you so much.
Yeah. Thank you, Pashti. A powerful story there, extremely well told. Thank you very much indeed. So it's a pleasure to introduce our next young systems leader for perhaps a little bit of technology, I think, in this presentation as well, and crucially, innovation. Let's hear it for Ketumetse Tamane. Welcome.
So in 2016, I stumbled upon the world of eye health unintentionally, and I wasn't planning to stay for long until 2 very specific moments in time. The first one, seeing the smiles on the kids when they received their first pair of spectacles because they could see the world a whole lot more clearer, and the yearning of the parents around them to actually also have their eyes tested. It was during these 2 specific moments that I realized that actually not everybody who needs eye health is able to access it, and also the role of technology in this, because this was during a peak pilot project in Botswana in a very remote district. The importance of equity and inclusion is one that is shared across all corners of eye health, and technology is going to play a very pivotal role in this. Technology such as Peak is playing a pivotal role in helping service providers reach people in remote communities, which is especially important for women, for children, for people living with disabilities, and the aging population, those that we know are usually left behind. In the coming years, technology can do more to help balance the scales in this regard. Number one, through large-scale adoption, which will bring services closer to the people that struggle to get the services. And these are the people that are usually in remote areas, as we all know. And automation of data analysis will mean service providers can quickly determine the equitability of their service distribution and even the quality of care provided. And it can also flag that people who is being left behind, and how can the providers be quick to actually address this. The last one is artificial intelligence, the not so new kid on the block anymore. When used correctly and ethically, artificial intelligence could be a great tool to bring forward very specific data insights that could improve service delivery. So, in order to achieve the ultimate goal of a world where we are no longer talking about 1 billion plus people needing eye care services, but 1 billion plus people actually accessing eye care services, my appeal to you today is, to you and to also my fellow awardees, is that instead of being apprehensive about technology, we embrace it, because it is upon each one of us to take responsibility, to understand it, to see it as an enabler that it is, as opposed to a blocker. Secondly, we need to advocate for national eye health policies that are open to the use of all types of technology to advance eye care services. Advocate, advocate, advocate. We don't say that enough until it is finally realized. And lastly, collaborations are very important. And I believe that is always the theme when it comes to eye health. So collaboration, please collaborate. And to close, I am happy to say that that unintentional stumble into eye health in 2016 has given me much more greater moments of joy. Thank you.
Thank you, Katie Messi. Can I just say, slightly unprofessionally, how much I'm enjoying this? I just think, wouldn't you, don't you think, Guess? I mean, Caroline, you're absolutely right. I think no wonder the hall is full of our guests. Thank you all. Why don't we just get some sort of snap reflections, perhaps just briefly, Ambassador. What's going through your mind as you're listening?
I am thrilled and stunned with the vision that lies ahead that these young people are putting forward. So I was very keen to hear about technology, to hear about gender equity, and to hear the issue on policy, the policy initiative. I think the policy initiative, we need to think about it in the context of rights. I am very, very pleased.
Thank you. Thank you, Sanduk. Please. Thank you, Ambassador. And funny enough, I was thinking, Ambassador, as you were talking, you spoke yesterday around everybody, the power of learning from others, cross-pollinating ideas, and that kept coming back to me as you were all speaking. Dr. Sanduk.
Yeah. It's really wonderful learning from all these three young aspirants. And the only thing that I like to ask or say to them is, do they still believe there is a role for teamwork, integrity, and a bit of passion? Do you think there is some role?
Well, yes, who would like to answer that? Hey.
Absolutely. I think I would say that in as much as we talk about technology, we talk about collaboration and team, it's also very much the heart of it all is the people, the passion, what drives them. So I do believe that it plays a big role. There's still a role for it.
Good question.
I definitely agree. Working in eyecare for 10 years now, sir, I really see that teamwork and more of its emotion that connects everybody of us and that is leading the cause that we are working for.
So I'm working in several organizations, not only like in optometry, but also in tertiary hospitals. So we are working with ophthalmologists, with technicians, with nurses, with everyone. And today I had a talk in the morning about multi-sectoral collaboration. So I believe we cannot do anything alone. So we have to collaborate together to achieve our main goal.
Thank you.
Thank you, Caroline.
I mean, Can I just say, Amir and Bharti and Kamitri, you spoke so well.
Mm-hmm.
You did a great job. And I guess my question to you, you have this room, and I asked you to hold your place and your power in this moment and to enjoy it. But also it's a chance for you. I want each of you to say something that you might need from this group of old lemons.
Old lemon. Well, that's a phrase I've not heard for a
Well, I
while.
mean, I know lemon. What but seriously,
Yeah, it's a great question.
Yeah,
Yeah,
what
yeah.
can we do to help you?
Yeah, great question. Amir, then we'll pass down.
You know, I just want to, before I start, I usually attend only optometry conferences. This is the first time I'm attending the IAPB. And to be honest, is the best conference I have attended in my life.
Thank you.
That's kind.
Yeah.
Thank you. You got to say that, right?
You know, because you are seeing a lot of leaders from different backgrounds, economics, IT, ophthalmology, optometry, and that's, you cannot see it everywhere. And like, to be honest, I met a lot of new organizations that can help our association in Lebanon, and we got this chance. So I'm just asking some NGOs like Peak, Seva, just to look into Lebanon. Lebanon need a lot. We need your help. We need your support. Cure blindness as well. We need to do collaboration to support the people in need in our country. Thank you.
Thank you, Mayor. Party.
Great answer.
Thank you. I just want to say that today, being a woman who has been into eye care for so many years, I just have one request, is to really support each other, irrespective of the gender. We have so much to do, and it's the little that we are doing into our regions. So it's very important that we know the need in the community, uplift each other, and do the best can we do. It's just the one person who just stand up and do, and everybody will follow. So it's not small or bigger organizations. I think let's take a pledge to really reduce the blindness into our countries and really focus on women who never take care of themselves, but they take care for you. So, yeah.
Yes. Thank you, Party.
Thank you for the question, Caroline. I think, first of all, I would like to say that we wouldn't be here if it wasn't for all of you. So already doing a lot for us. But more than anything, as I said, advocate and collaborate. Advocate for your governments, advocate within the institutions that you work in to actually push the agenda of eye health for everybody. Let's not make it, I think it's Amir who said it, it is not a luxury, but it's a right. Yeah. And more than anything, collaborate. I think a lot of the times we talk about working in silos. I believe that it's time to just, get out of that box, get out of that little circle, and just work together really well and see where we align. And like I said in the other session, let's look at the why. Why are we doing it at the end of the day, all of us here? So yeah, that's it.
Thank you. Right. Here's to that. Let's say so long to silos. I totally agree. Now, thank you. I wish we had a bit longer, but for now, we're just going to have to say to the three of you, and please, that's why we're so happy you're here with us in Nepal, because we can spend more time over the next couple of days getting to know each other. But for now, thank you very much indeed. Thank you. And as they leave the stage, it is a great honor to call our next three systems leaders. So please give a welcome as they step up to join us. Dr. Matan Arazi, Sabrina von Vegera Eliseche, and Samit Sakib Gaur. Welcome, one and all. Thank you, Sabrina. Welcome. And Dr. Matan, I think you're going to kick us off, if that's all right, with our 3 minutes. Everyone gets a round of applause just for taking their place here.
Yes, they do.
Okay. Hello, everyone. My name is Matan Arazi. I'm an ophthalmology resident based in Israel, but I'm currently a master's student at the London School of Hygiene and Tropical Medicine. We're at a critical juncture. ambitious frameworks like the WHO's eye health targets and the 2030 Insight Strategy show that we know what needs to be done. But too often, there's a disconnect between these global ambitions and what actually reaches people on the ground. I work at the intersection of clinical care and health systems. Through my thesis, focused on countries like Nepal and Kenya, I'm exploring how national plans are translated into practice and what barriers stand in the way. A country may set, for example, cataract surgery targets, but without systems to monitor access and outcomes, support the workforce, or embed eye care within broader health services, progress can stall. The intent is there, but the follow-through is fragile. This isn't about lack of effort. It's about structural challenges, fragmented data, limited coordination, overstretched systems that make implementation harder than it should be. So, here's my vision. I want to see a future where global eye health policies are not just well-crafted strategies, but living frameworks that drive measurable, lasting change. That means shifting from what countries should do to how they can realistically get it done. It means listening to and working alongside policymakers, providers, and communities, those closest to the problems and the solutions. And it means placing implementation and policy research at the heart of our global response, not on the sidelines. My passion is to help close this implementation gap by generating research that strengthens systems and by working with global partners to make policy meaningful where it matters most, in clinics, in communities, and in everyday decisions. Because if we truly want to close the gap, we must do more than set targets. We must empower countries to adapt and deliver them in ways that reflect their realities and needs. That's the future I'm working towards. And I believe that with humility, collaboration, and focus, we'll get there together. Thank you so much.
Thank you, Matan. You will find many kindred spirits here. This is excellent stuff. Thank you. Sabrina, welcome to the podium, and congratulations.
Imagine the way clean water flows effortlessly from taps, reliable, essential, and available without a second thought. That's the future I imagine for eye health. We know that ensuring clean water often involves adding chlorine, a small and cheap intervention with enormous impact. Over time, water safety became automatic in many parts of the world, not because people thought about it daily, but because strong systems were built. Building those systems was expensive, and where we haven't achieved it, even the small daily act of adding chlorine remains a major hurdle, leading to preventable sickness and death. Systems save lives. We can do the same for eye care. We already have many of the tools, technologies, and medical knowledge, just like we once discovered chlorine. Thanks to the work of eye care professionals, research, innovators, strategists, we have made eye health care interventions cost-effective, and we're building the case for its role in development, which I'm personally very passionate about. With that foundation, now we need to build systems that make eye health the default, from birth through school into adulthood and old age. Innovation is key. We must make interventions simpler and less invasive. We must use AI smartly and ethically, not only to read eye images cheaply, but also to predict who is most at risk and automatically guide them to care. And to truly make eye health easy, universal, and effective, We must be honest about what we still need to understand better. We have studies showing that glasses improve learning outcomes for children and productivity for adults. But do children actually wear the free glasses we give them? Does charging a small fee increase their use, or just create a barrier to access? Take something more specific. Why do some parents who fought hard for a premature baby survival still miss critical ROP follow-up treatments? And zooming out, when it comes to healthy living, we might all agree that diet and exercise matter, also for blindness prevention. But what kinds of macro policies actually make the healthy choice the easy choice? And finally, even with access, why do so many older citizens resign themselves to vision loss, as if it's just a natural part of aging, not something worth treating? We need rigorous impact evaluations. We need social science researchers on board, smart policy design, and sustainable financing. Because good eye health must not depend on extraordinary individual willpower, on people crossing rivers or indebting themselves for surgery. It must be built into society as natural and effortless as clean water from our taps.
Thank you, Sabrina. Super powerful on the power of systems and also on design. Thank you. Well, I will ask our three special guests to reflect after we've heard from our third guest, Samit. The floor is yours. Welcome and congratulations to you.
Good afternoon, everyone. Today I stand here as a son of a man who spent his entire life ensuring that no one lost their sight, whether from curable blindness or uncorrected refractive errors. My father taught me that vision is not only what we see, but what we believe is possible. He had no formal education. He started as a truck laborer, but with a clear vision, to serve the underserved and give them access to clear sight. Over the next 34 years, he reached over 1,700 rural villages in India, running free eye camps. As a child, he would take me with him. And honestly, sometimes I didn't really want it to go. I'd rather be playing football. But that would soon change. One day, I watched a grandmother see her grandchild clearly for the first time. She just held him, kissed him as tears started rolling her eyes. That moment stayed with me. And that was the moment where I found my purpose. But the biggest shock came to us during COVID-19 pandemic. My father, he became seriously ill. He spent 15 days on a ventilator in hospital. And when he returned home, he said to me, Samit, I didn't worry about our family when I was in hospital. When I'm gone, who will provide the people we serve with the eye care that they need and deserve? The moment carved a permanent mark on me. Because crisis didn't just shake us, it revealed a gap. Our entire cause was vulnerable to external decisions. And that's when we knew sustainability isn't a choice, it's a survival strategy. We decided to build a system that would not depend on us, but something that would outlast us. So in 2022, we launched Vision Friend Eyewear, our first social enterprise. All the profits we generate goes back directly to providing more free eye camps in the rural areas. And today, the VCU series, a global solution to make quality spectacle affordable and accessible, because over 1 billion people today live with uncorrected refractive errors. Not because glasses doesn't exist, but because they cannot afford or access them. Our specs starts at just $0.38, customizable, certified, and compliant with international standard, and purpose-made for every kind of vision care programs. We wanted to make spectacles meaningful for you, not just affordable. Millions of spectacles are distributed every year, but how many of spectacles bear the name of the organization that gave them? How many children remember who helped them see the blackboard again? We are not here to build our brand. We are here to build yours. That's why we offer white label option. We make your specs your story. VCU isn't about selling eyewear. It's about supercharging your mission. We have lowered the cost. Now we must remove the barriers. Affordability is no longer the problem, but distribution is. I believe no great movement is built alone. True change happens when visionaries come together and build something greater than themselves. So please, I say my father always says to me that we cannot control how long we live, but we can control how long our work lives on. And this is our shared legacy. Will you all join us? Thank you, Dad.
Samit, thank you. That was a storytelling masterclass. Thank you. Caroline, please, I'm not reflecting. That was very powerful.
Well, like our first three, I just want to say, Matan, Sabrina, and Samit, you all just nailed the speaking. If we could all speak as well as you in such a concise and clear way, just want to say fantastic.
Yeah, yes.
Really, thank you. Amazing. Because that's hard. 3 minutes of incredible. I have a question for you. We're all saying the good things here because we're talking about the good things, but you each face barriers in your work. All of you do. What is it that this room can do to help each of you in a particular barrier or a sticking point or a frustration for you as you lead into the future? What are one barrier that this room or people can help you with or come up and talk to you over the next few days?
And I want to get a question from each of our guests. So let's go snappy on the answers so we get even better time all together. But first, Matan.
Thank you for that question. What barrier? Well, there's so many barriers to speak about, but I think one of the biggest barriers that we have is actually moving policy to action, moving conversation to action. And that's really what I think my research focus is about and what I'm really passionate about, to understand what are the actual barriers and facilitators to actually implementing these amazing policies that we have, these things that we really want to change the world and really provide eye care for all, but is it actually being implemented on the ground?
Yes. Thank you. And Sabrina, I think to Caroline's question, feel free to share a personal barrier or something involving your work as well as more broadly, wherever you want to take the answer.
I think our generation needs mentors. I think we each face different kind of barriers, but what we really need is the experience you have. And being able to mentor someone means time. So instead of doing all the work, have a little bit of time, where you can mentor the next generation, right? We don't want the work to stop with you. We want to be able to continue it. But we would like to learn from your very personal experiences, work-life balance, right? The need is great, right? And where do you stop? When do you go to sleep, right? And in general, I would love more mentorship and research, because that's what I do, right? And so, I think mentorship is a big one.
All right, well, you've got a lot of support from your fellow systems leaders there. Let me ask a question. Provisionally, who in the room would be interested in helping to mentor either a young systems leader or one of their peers? Will you raise your hand now, please?
So can we set up a program to do that? Am I getting a commitment?
We would love that.
Watch this space. Samit, what's your answer to Karen's
So I
question?
believe, as I've said in my speech, the biggest problem is that we are working towards Specs 2030. But the biggest problem here is distribution. It's accessibility. We can get something at an affordable rate, but how we get it to people? We need organizations to come together and find a way to reach more people, because we have the things. But we need distribution, we need ways, we need to make it accessible.
So the dream phone call comes in tomorrow. Who's calling?
Dream phone calls coming tomorrow.
On distribution, that's what you need. But who calls you? You said, this is the breakthrough. This is who I was hoping would call me.
I think right now, yesterday I attended a meeting with Coalition for Vision, and I think they are doing amazing work, and I would love to work with them.
All right, okay, well, we'll keep encouraging that. Thank you for your impact entrepreneurship. A brief reflection, Dr. Sandhu.
I think it's extremely nice to listen to each of you's story in a different way. And it's not a question, it's a kind of a suggestion that I have, is I wanted to ask you how much of thought you've given to innovation and out-of-the-box thinking, A, and how much do you think your willpower helps you at this stage of the career? If you have a good willpower, I'm just talking about the stage you are in.
Well, we might not have time for everyone's answer, but who would like to have a crack? Go on. Go on.
So I believe regarding the willpower part, for me, my skin is in the game. This is about legacy. So, and apart from that, a lot of organizations are doing incredible work. So I would love to be and work with them. So this is the willpower thing for me.
I think I also feed on the willpower of other people. It's not just on me. I think it's on working with other people that help us on our organization. So yes, there is willpower involved. There's lots to do, but you really want to work on a team. I think that helps you when you don't have the willpower to push through the next barrier, right? And they can help you.
Well, that's gracious, Matan. Ambassador.
I don't know if I have a question, but for me, it's really inspiring to hear the thinking. But I'm just wondering, as the focus of this meeting is on things like getting the members to look and collaborate and reach out, in systems thinking, in leadership, in communities, how do you reach outside of your network, outside of this group? Because the answers are not always inside this group. So what thoughts are you giving to reaching outside? If you're going to expect a new shipper, it's not going to come from this group. What are you thinking?
So as part of our Young Systems Award Leader, we've had various amazing sessions with phenomenal people all over the world. And I remember one from Chica, I forget her last name, from Africa, who told us that one of the keys to her success was meeting as many people as possible. It's basically a numbers game. Going to every type of conference that you can, any type of work meeting, any type of event, and just meeting as many people as possible, because you have no idea how far you can reach. You will find the most amazing people that are just not even directly involved with what you do, but somehow can get involved and you can collaborate. So I really take that to heart and will take that advice forward.
Yeah, it's great. And briefly, please, Sabrina, come.
So thinking outside the box, I was really inspired by the IPB program of getting leaders to work with you. So what we did was, I'm from marketing background. So what we did was, we tried to involve the chief minister of our state. And what we did was, we named a spectacle after him.
Good.
So now he has, it's personal for him. So we have some new laws for the state government that we want to push forward. And now I think with the representative that he sent just to record the event, I think that we will be able to get them passed soon.
That is a cracking technique. Love that. Sabrina, did you want to join in?
Yeah, I think it's very important to just talk to as many people as possible. When we go back and we're on the plane and they say, what were you there for? And you have a good elevator pitch of why it matters to you, and do that continuously. People have lots of connections. And so if you can get one of those conversations to matter, that's very important already.
Brilliant advice. Thank you to all three of you, and huge congratulations on being our Young Systems Leaders. Thank you very much. Good to see you. Thank you. Well, it's an honor to invite our final two Young Systems Leaders up to the stage. Please give a huge congratulatory round of applause to Tujist Tulu Galashi and Tan Ting Fang. Welcome both. We'll come and have a seat just briefly. By the way, now's a good time to admit, Tujist and I actually shared a car from the airport to the hotel together, and although we talked about lots of good things, I've realized I missed my chance to get your autograph. So maybe I have to try again. I'll get one later. But it's such good advice about talking to everyone. So look, congratulations to both of you. You're our penultimate speaker today. So congratulations, and we look forward to your thoughts. Thank you very much. Well done, Tujist.
Hello, everyone. I am Simple, but powerful idea. Eliminate needless blindness by collaborating as a team. I was actually a professional football player for over 8 years and a captain of a women national team. I know how to work as a team and thank you. I know how to work as a team and a league with passion to score the goal and win the game actually. So, I bring the mentality of winning, energy, teamwork, and collaboration to project implementation with my organization, Cure Blindness, especially in Ethiopia. I want to share with you an inspiring example how me and my colleagues at Cure Blindness Project transforming eye care in Ethiopia. As you all agree, quality health care, especially eye care, supposed to be effective, safe, and people-centered. Not only that, it must be delivered on time, efficiently, and equitably. So in order to do that, we have to build system as a collaboration. So as Cure Blindness Ethiopia team, we are building the system through capacity strengthening of the partner hospital, equipping surgical and non-surgical instruments by providing them fully and supporting them to have standard surgical and non-surgical procedure, manuals, tools, and new quality initiatives to guide the quality of daily service, plus for effective cataract surgery coverage. So, all these systems, above main system, will be executed for all partner hospitals. That means Cure Blindness working with partner hospital of the all 7 tertiary eye care institutions, over 20 secondary eye care centers, and primary eye care projects for selected 4 regions. So we collaborate those primary, secondary, and tertiary eye care centers to do at the primary care, to do community level screening, community level mobilization, community level health education, treatment for trichiasis surgery on the spot at the community level, and referring comorbidities and other things to the secondary and tertiary care respectively. Then the secondary care level hospitals, they will continually support the routine treatment plus annual cataract surgery for all those referred patients from the community level individuals. So they will work integratively with the primary care eye caregiver at the community. The tertiary care level, other than providing training and supporting teaching on residence and fellowship, they will perform all referral cases at a routine service or routine basis. Plus, they will collaborate with secondary care level to support and clear the backlog of cataract at the secondary level as an annual cataract surgery program. So this integration can bring the results speak for themselves actually. Except in Ethiopia, no. In Ethiopia only, we achieved the highest geographic and population coverage of eye care system. And from this, 6.37 million eye screening and basic treatment done in 1 year. Plus, more than 718,000 life sight restoring surgery was done, and including over 200,000 cataract surgery by outreach program only. Imagine, in 2024, by team that led by me and my colleagues in Ethiopia, we managed to do 36,367 effective cataract surgery within 1 year. And 12,000 of the effective cataract surgery covered by 1 month. So, I believe, actually not only me, I believe, and including Cure Blindness Project, collaboration is the key. So, and let's integrate, collaborate, and build the system, then we can eliminate needless blindness sustainably and over. So I have one question for you. What will be your role be to avoid or to eliminate needless blindness and collaborate with us in all over the world? Thank you so much.
Thank you, Tajist. As your former colleagues would say, she shoots, she scores. Thank you very much. And finally, Ting Fang, congratulations and welcome to the podium. Well done.
Hi everyone, I'm Ting Fang, a resident from the Singapore National Eye Centre. To be able to embark on this journey in ophthalmology has always been a dream for me. And to be part of the Artificial Intelligence Lab in our centre has been exciting and inspiring. As a junior resident, I envision to seek ways to integrate technology to improve eye care. We have seen how technology has revolutionized the delivery of healthcare services. The COVID-19 pandemic, for example, has seen increase in uptake of virtual healthcare services to increase accessibility and reduce exposure risks associated with in-person consultations. Another important example in the Southeast Asia region, back home in Singapore, is the evolution of our diabetic retinopathy screening program. So patients with diabetes are screened annually for diabetic retinopathy, and traditionally this is done in person by an ophthalmologist. And we've seen how the adoption of telemedicine has allowed the fundus photographs to be captured in community clinics and transferred to reading centres to be graded post hoc by non-ophthalmologist trained technicians. And now, with the validation of AI deep learning models, we are able to automate the grading process to increase efficiency and cope with the ever-increasing load and patients requiring screening. So in Singapore, we have an aging population with 6 million people in a very tiny land area. One of the major challenges we face is the demand-supply mismatch, and this results in increased wait times for ophthalmology referrals from community clinics into our tertiary eye centres. So as a result, this may result in delayed care and also patients being lost to follow-up. I believe that we can leverage AI to improve our existing referral pathways. One way I can imagine is to allow chatbots to elucidate presenting complaints from our patients and to use AI deep learning models to analyze fundus photos and anterior segment images that is non-invasive and easily captured by non-ophthalmologist trained staff. And this can be coupled with simple parameters like visual acuity and intraocular pressure, and use generative AI to combine all this input to generate a triage outcome, whether the patient can potentially be discharged, require urgent review, or be automatically booked into the relevant subspecialty clinics. So technology is rapidly evolving. It is exciting. But more pertinently, I believe that it is our role to constantly seek ways to challenge existing workflows and to not accept the status quo. And starting from a junior resident right now, I envision to constantly seek ways to integrate innovation to translate its impact into action. Thank you.
Thank you, Ting Feng. By the way, we had a fantastic 2030 Insight Time in Singapore 2 years ago. We're very grateful to colleagues there for that experience. Honoured guests, some reflections on those two final speeches. Ambassador.
Thank you very much. Again, what can we say? Except to say that with you two plus the other 6, the future looks bright. But I think I was very heartened when I heard again someone speaking of technology and the linkages of the use of technology into eye health and how we use an artificial intelligence to address. This is the cross-pollination that we need. This is the kind of thing we have to reach out to bring others into our field in order that we all can work together for the transformation of humankind that we want. I am I'm not a betting man, but I will bet we are going to go far with you 8, and I'm very proud of all of you.
Yeah, here's to that. Please, Dr. Lewis.
I have one question for Ms. Stan. And, do you believe that in about 30, 40 years, we're going to need much less eye doctors than now?
Please, yeah.
Thank you for that. So I think when AI started and as it's evolving, it's always the big question of, do we still need ophthalmologists and will we be replaced? But I think with my tiny journey so far embarking in this space, I feel that the key is using AI to help us and to make us more efficient. The end goal is not to replace us, but to use it in an effective way to help us do things better. At the end of the day, I feel that coming into medicine, into ophthalmology, it is still the human contact, the personal contact that we bring to the table, and which is why we started this journey in the first place. So I don't think that even with technology, the end goal is to replace us, because that is the very essence and fundamental beauty of medicine. And what we should focus on is to use technology for its advantages and to minimize its potential harms and risks to patients, with the patient at the heart of what we do at the end of the day.
Yeah, to our beautiful
well, Ting
lady.
Fang, there's a career in diplomacy for you if you want it.
To our beautiful lady from Cure Blindness, I just wanted to ask her, what sort of challenges do you feel do you get, number one, number two, in the office and in the field when you're working? Just share with us.
The challenge overcome as a team. So, yeah, there is a challenge, especially screening patient at the community level, and knowing that he have cataract and refusing to have surgery is the first challenge. And the second challenge is still at the field. We do the screening and cover the cost, and the surgery, we cover the cost, including transportation and everything, because they come from remote area. We bring them to the secondary eye care level, and then after they get their vision, they're not gonna come the first week and 1 month follow-up. It's kind of sometimes irritating, and I even cry. So that's the second challenge as a community level. At the office, as I am an optometrist and energetic so-called prayer was actually, I don't want to be sit and do the project tasks. I want to run and do things by myself at the community and care for the patients. But I'm currently learning the modern way. People cannot be run at the same time they're supposed to do the system at the office. Thanks to my colleagues, they were telling me and then give me, tell me the gap and give the energy, the commitment to growth on the office task or daily project implementation. That's why I take a course, project management, to learn more. Thank you.
Yeah, really honest answer, love it. Thank you, Tajist. Great questions, thank you. Caroline.
And again, you nailed it, both of you. Tajist and Ting Tang, thank you so much. I'm going to keep it brief. Your generation have a very different view of how we work together, how we hold each other to account, our expectations. For either of you, around either cross-pollination between technology and people or collaboration, what do you believe is essential? That essential new way of working, because collaboration is essential in the new type of leadership in a very complex environment. So maybe to just for you, what is the essential new need or thing to see for collaboration?
I think for me, I believe that it would be to have an open mind and to be just willing to accept and to learn and to see what others have to offer. And I think that's the very basis of it going to collaboration, because everyone has their own agenda, their own interests, and if you go in with all these barriers, you may not be able to make the most out of it. So I feel that having an open mind at the very get-go, stepping in, will make the best out of the collaboration. And I think that for me, for example, being able to come here to IAPB is really a very exciting experience. I live in Singapore, and I feel like the way I grew up has been so sheltered, and I live in a bubble, and I really don't know what is out there, and let alone medicine. This career, it is very sheltered. Like, the path is structured, everything is very standardized. So being able to come here and through the Young Systems Award leaders, being able to meet all these amazing individuals allowed me to see the challenges they face that I couldn't even imagine that people are facing that, and to hear their personal stories. So I think that has reminded me that in the future, when I go into collaborating with more people, to always keep an open mind, because you never know what you can get to learn from them.
Yeah.
Thank you.
Brilliant answer. Thank you. Well,
Tajis, can we
yes,
find
please, absolutely, Tajis, on the same question, please, forgive me.
Okay, I can say two things actually. From project perspective, collaboration can reduce costs highly, because the same task can then by 5 for like a NGO or eye caregiver. Instead, where they collaborate, one of them will do the field tasks, the homework and everything, and one of them can do the patient care side. So it will be cost effective. When you come to other things, collaboration is a key actually to success and to have sustainable product or quality service in the world. So I believe in collaboration. That's why I make it my title actually. Thank you.
Thank you, Tajis, and thank you, Ting Fang, as well. So all I would say is that we've heard from each of our 8 of 9 young systems leaders, and in case any of you are wondering, did I do a good job? You all smashed it. So we absolutely loved it, didn't we, honoured guests? Thank you. I do think to myself, you know, we've got 5 minutes left to run in the session, which is 5 minutes of mischief opportunity as far as I'm concerned. So I thought it would be fun to turn the tables a bit and wonder to myself if the systems leaders have got any questions for our 3 esteemed panelists. But as you're thinking, I've also noticed there are 9 sofa seats in front. So I think, don't you think, Caroline, they've more than earned the right? Do you think? Well, will you give them a round of applause as they stand up and take their seats in the front row? Come on.
Come on.
Come on down,
guys.
everybody. Yeah, come on.
Up here to the sofas.
Come on, don't worry, they're not reserved anymore.
Come on.
Don't worry. Yes, please, Tajis.
These are for you.
They're for you. Come on down. Come to the front row.
And Ollie, just as they're taking their seats, I want to make a very enormous shout out. People need to get credit where it's due. And I just want to say, I know the young system leaders would want to put a huge round of applause to the amazing Anna McKeown, who has crafted and curated and worked on this program and project. Anna, will you stand up, please, for me? There she is. Thank you, Anna. Thank you so much. And also we have Kai, who was one of our young system leaders from last year as well. So could we give Kai, stand up there, because our alum is back. Thanks, Ollie.
Here we are. Now, Matan, come down. Look, there's plenty of room at the end. Come on, here we go. No, we don't need to share.
Yes.
It's not like the cinema. Right.
They're going to grill us.
Okay, well, we've only got a few minutes, but let's make it funny. It's time to turn the tables. Who's got a question? Here we are. Matan's got a question. Look, they're lining up now, and then Patti. Go on.
I promise it won't be a hard
You've
question.
given away your mics.
Now we're going to see collaboration.
Stand by, sir. Matan, go.
So, first of all, I'm so honored to be here. Thank you so much for allowing us to present our ideas for the future of eye health. And I kind of want to reflect that question back to the 3 of you. Where do you see the future of eye health?
Oh, that is a big one, isn't it? Right.
The future of eye health.
Of eye health.
Future of eye health, Ambassador.
For me, it's very simple. We are not meeting the future. You people, you wonderful, outstanding young people, will shape the future. So where do I see the future? The future is in your hands as you shape it.
Yeah. Now, let's pause. I could get something from all of you, but I want more questions because we're going to be out of time, Sandu. Bati, what's your question?
As IAPB has introduced this Young System Leaders Award, where you really look, these young system leaders will make a big impact in community ophthalmology.
So just frame the exact
Okay,
question.
so I'm just asking that we have our own agendas, but where do you see that will be the most useful, or where we should actually take the lead, or maybe the most impactful leads we should take?
Okay, well, would you like to answer that, or will I answer? Because go ahead.
Yeah. I would probably think that very strong collaborative effort of working together with similar organizations and stakeholders for a similar goal. That's very important. And second is, I think together we need to do a strong advocacy for non-governance of the government. That's where the problem lies. Yeah. So how you can do that from each of us, and I'm sure there is going to be a strong collaborative effort from everybody. But that I really see is the key points.
Yes. Thank you, Dr.
And
Standard.
I think to build on that, Barsi, everybody knows that it has been in my dream that we will have 193 young system leaders to hold their heads of state to account, to deliver on their promise in signing that resolution in 2021, and to promise and to be measurable and accountable. You are the future. You have to help others behind you see the future, and you must hold your heads of state to account.
I will just add that really any difference we are going to make is not going to come from government, even government policy. It's going to come from you working at community level and working with local people. You are doing more than participating. You are the ones who are going to make government take the shape. Because some of you may be the government one day.
Here's to that.
They're the leaders of the universe.
Now, we've got time for one final question. Yes.
So I have a question for Dr. Sandhu Kurit. A colleague of yours told us how you decrease the prices of IOL lenses in Nepal while you're manufacturing them. So what suggestion can you give us as young social entrepreneurs of what we can do to expand or to scale?
Yeah, that's a hot spot.
How can young
can you
social
just
entrepreneurs
say that
expand
again?
and scale their
Can you-
businesses?
yeah?
Yes, please.
Scale that?
Yeah.
Thank you very much. And the whole process of conceptualizing to construct an IOL manufacture facility in a country like Nepal way back in 1990s was an extremely Herculean task. We had lots of obstacles, but we overcome. Yes. And we have started manufacturing extremely high quality. Now the next phase is scaling up into 3 times or 4 times of the unit. And I think right now we are enriched with a beautiful group of skill and intellectual property who can do that work. But we need little fund. And I'm going to do an aggressive fundraising for manufacturing this lens. We can supply maybe 1.5 million every year. And we have till now done 7 million lenses all around the world. And we will continue to do that.
Good. Very good. Well, alas, we have been beaten. I mean, unless it's very quick, is it?
Yeah, very quick.
Go on.
Oh, go on, Amir.
Your Excellency, with the US stopping its funding to WHO, do you think this will weaken the WHO role in global eye care, or the WHO will start looking into small NGOs to support them, so it will make those small NGOs bigger role later on? Thank you.
Well,
So
I think
the
we need to let the
WHO
ambassador
withdrawing its
answer that
funding,
question.
might we see funding going towards much smaller organisations? So this is what we call ending on a light-hearted, trivial note. Just a little bit of fun.
Ambassador, do you
Ambassador
want to answer that?
Webster, you're getting 2 mics for the price of one.
Good grill, Amir.
Well, if I had a crystal ball, I would tell you, right? But I don't know that WHO it's not about WHO, really. We are going to be getting more resources through philanthropy in the short term. If you were in the session this morning when I spoke about development, you would have heard me say that we are in a critical period in history, and where development is now under threat. So now we have to, and this is where your movement, reaching out to other people, becomes important. And it's not about whether it's a smaller organization or not. It's about how you could build alliances and build partnerships in order. So because it's not just going to be your organization or my organization. It's going to be our organizations working together. So let's continue to build alliances, reaching across, as a politician I would say across the aisle, but reaching across the sectors. And that's how we're going to scale things, and that's how we are going to continue to build things, not in silos or in small individual groups.
Yeah. Thank you, Ambassador. Thank you, sir. Well, with that, I'm going to put the spotlight back to where it belongs. We're going to see our young systems leaders back on the stage in our closing ceremony. But for now, let me ask them all to be upstanding and turn around and face our audience just to say thank you and a huge congratulations to all of you. And finally, before we break for just 10 minutes, just to say how good it has been to see 3 of our leading lights lit up by the brightness of today's and tomorrow's talent. So to our 3 honored guests, we're so grateful to you. Thank you to our audience for your support. And thank you, of course, and congratulations to our young systems leaders. We'll be back for our closing ceremony in 10 minutes' time. But for now, thank you and congratulations again. Thank you.